Adrenoxyl uses, mechanism of action, and important considerations. Adrenoxyl 10 mg, containing the active ingredient carbazochrome dihydrate, is a well-known and effective hemostatic agent. It's important to note that adrenoxyl does not directly affect the clotting process. Instead, it primarily acts on blood vessels, especially capillaries, strengthening their wall. Adrenoxyl uses, mechanism of action, and important considerations. Adrenoxyl uses, mechanism of action, and important considerations. Adrenoxyl 10 mg, containing the active ingredient carbazochrome dihydrate, is a well-known and effective hemostatic agent. It's important to note that adrenoxyl does not directly affect the clotting process. Instead, it primarily acts on blood vessels, especially capillaries, strengthening their walls and thus controlling bleeding. Key uses of adrenoxyl 10 mg. Controlling capillary bleeding. Adrenoxyl is used to manage bleeding from capillaries, including epistaxis, nosebleeds, mucosal bleeding, bleeding from minor injuries, epistaxis, nosebleeds, mucosal bleeding. Key uses of adrenoxyl 10 mg. Bleeding from minor injuries. Surgical preparation. Adrenoxyl can be used to minimize the risk of bleeding during minor surgical procedures. Epistaxis, nosebleeds, mucosal bleeding, bleeding from minor injuries. Mechanism of action of adrenoxyl. Strengthening blood vessel walls. Adrenoxyl enhances the strength of blood vessel walls, particularly capillaries, helping to control blood leakage. Mechanism of action of adrenoxyl. Vasoconstriction. Adrenoxyl is an oxidation product of adrenaline and exhibits vasoconstrictor properties. However, at therapeutic doses, it does not stimulate the sympathetic nervous system. Pharmacokinetic properties of adrenoxyl. Elimination. Adrenoxyl is primarily eliminated through urine. Absorption. The drug can be absorbed orally or via injection. Metabolism. A portion of carbazochrome is metabolized in the body, but a significant amount is excreted unchanged in urine. Important considerations. Adrenoxyl is not a substitute for traditional hemostatic methods such as applying pressure, using splints, or surgery. Using adrenoxyl should be done under the guidance of a physician and following the prescribed dosage. Important considerations. Do not self-medicate with adrenoxyl without a doctor's prescription, especially if you are pregnant, breastfeeding, or have a history of allergies to any component of the drug. Important considerations. Adrenoxyl can interact with certain other medications. Inform your doctor about all medications you are taking, including prescription drugs, over-the-counter medications, and herbal supplements. If you experience any side effects, report them to your doctor promptly for advice and timely treatment. Conclusion. Adrenoxyl 10 mg is an effective hemostatic agent, helping to control capillary bleeding. However, using the drug should be under the supervision of a doctor to ensure safety and optimal efficacy. Additional information. Adrenoxyl may be used to reduce capillary fragility and improve blood vessel integrity. The medication is generally well tolerated, but possible side effects can include headache, nausea, and dizziness. Additional information. It is important to note that adrenoxyl's effectiveness may vary depending on the underlying cause of the bleeding. Additional information. Remember, this information is for general knowledge purposes only and should not be considered medical advice. Consult with a healthcare professional for any specific medical concerns or before making any decisions related to your health or treatment.